our goal was to saturate rural Kenya with the prevention message of HIV, AIDS, TB, malaria, and typhoid. That was our goal. We found that we had different spokes coming off. We got the Kids for School, we have the Girl Child, we have the Wheat Project, we've done water projects, and yet it's the heart teams that are keeping it rolling because they're coming and bringing their resources and helping it going. Then we've had Seroptimus teams coming, and the Rotary and the various different kinds of groups that are coming. Medical teams, and they're not always associated with a church.
This is now my 9th or 10th trip. I've lost track. And I actually retired partially to continue this work because it's so rewarding and because there's such a huge need here for HIV expertise.
And whether it's you have skills in computers, you're a mechanic, you're a carpenter, whatever it is, we need it.
It didn't matter that I was not a professional medical person because my camera came in handy very much. They were glad to have someone that was there to record what was happening and what they were doing. We just got right down on the ground and treated those patients, and it was just like an ER right there on the grass. And it was fantastic to get right in there with a camera.
I wanted to come to Kenya, but for 4 or 5 years I couldn't do it. But I can pray. And so I prayed for heart. I prayed for the ministry here, for the people, as well as to give financially. And some, you know, I never had a lot of money and still don't, but you can, what little you have really goes a long way here.
And we started having annual heart dinners, and at one of those heart dinners I had a Kenyan physician that was working at UC Davis come up to me afterwards, and she said, "Vicki, you've done so well at showing the needs in Kenya and how you're addressing them. But what you haven't done is showed the beauty of Kenya." And she said, "Don't you take them on safari? Don't you let them see all the beautiful things about Kenya?" And we decided to incorporate into the team experience a 3-day, 2-night safari every time a team comes. I've had so many people say that I've done more in 2 weeks to help a larger number of people than I've done all year long. So they take their vacation time, all their money, you know, to come and do this. And it's been totally amazing.
What I love about Heart is that the way Heart empowers the Kenyan people to help themselves for sustainability, that if Heart ceases to exist, the Kenyan people don't. They can continue on with what they've been taught.